of Patient Education and Support for the Crohn's and Colitis Foundation. To all the veterans out there listening, we want to thank you for your immense courage and for your service to our nation. In recognizing this special day, the Foundation welcomes two very special guests this evening who will be candidly sharing their experiences, an uplifting message for veterans and those currently in service who are living with IBD. And did you know that there are nearly 70,000 veterans living with Crohn's disease or ulcerative colitis? If you are among those individuals, know that you are not alone. Joining us today are our guests, Lieutenant Colonel Joshua Nelson and Dr. Meena Prasad, Director of Inflammatory Bowel Disease at the Atlanta VA Medical Center. Welcome to the program.
Thank you, Kat.
Thank you, Catherine.
Absolutely. So before we get started, let's go over a few quick pieces of housekeeping. Although most of the discussion for tonight's program will be about personal experiences and dialogue about being proactive in your care, the information provided during tonight's chat is meant for educational purposes only. It should not replace any advice you receive from your gastroenterologist, your primary care provider, nutritionist, or surgeon. If you have questions about your specific care, please reach out to your healthcare provider. If you do have questions about IBD that we do not get to this evening, you can contact our IBD Help Center by calling 1-888-MY-GUT-PAIN or emailing us at info@Crohn'sColitisFoundation.org to get your questions answered. So with that, let's get started. And I'm going to start with you, Josh. So tell us a bit about yourself, what branch you serve on, and your particular experience with IBD.
Yeah, perfect. That's an excellent question. And good evening, everybody. My name is Lieutenant Colonel Josh Nelson, and I am 40 years old. I reside in Minnesota. I have served in the Air Force for over 20 years so far. And back in 2017, with no family history or medical history whatsoever, I was unfortunately diagnosed with inflammatory bowel disease, ulcerative colitis. And it kind of came out of nowhere for me. The reason why I was diagnosed with ulcerative colitis is because leading up to that time, I was diagnosed with actually cryptosporidium, which is a nasty parasite that kind of ruins the GI tract. And so I was trying to recover from that, but I actually never truly recovered. The bowel movements continued. And later on, I actually started to notice blood in my stool. So I seeked medical care. I started out with my local family practitioner, started to prescribe some basic medication, but still wasn't getting any better. And I was actually inpatient hospitalized in early November 2017. They performed an emergency colonoscopy on me. And I was actually discharged a couple days later, received a phone call while I was at home, and the doctor said I had been diagnosed with ulcerative colitis. And I remember thinking to myself, what in the world is ulcerative colitis? Truly, really didn't know what it was. So I started to do what everyone really does when a disease or an announcement of a disease lands in your lap. I get on the internet and I try to find out more information about inflammatory bowel disease, ulcerative colitis. I ended up stumbling on Crohn's Colitis Foundation, which was a great resource, United Ostomy Association of America, which was a great resource. And the goal at the time was just to manage the disease that I had. Unfortunately, when I was diagnosed with inflammatory bowel disease, it's a disqualifying condition for a lot of service members, the Air Force included. So I was grounded. I could no longer fly the airplane. And the goal was to try to get on a medical regimen that would keep me stable, the disease in a state of remission. And part of that would be me providing, laboratory results, documentation to show that the medication is truly working. I never quite got there. It seemed like every couple of months, the blood in the stool would start to appear again. The multiple bowel movements would start to appear. And I just really wasn't getting any better. And really, my wife was one of the lifesavers with my condition, is we weren't really happy with the care that I was receiving, because when I would call the medical facility, say, I've got blood in my stool, they're like, we can probably get you in about 4 to 6 weeks. And we really didn't like that answer. It's, something's wrong. And the earliest I can get in is about a month, because I wasn't getting any better. So I was fortunate enough to be in the state of Minnesota. We have the Rochester Mayo Clinic. We have the University of Minnesota Medical Center. So I was actually evaluated by both of those locations. And that is the first time I heard about an inflammatory bowel disease specialist, someone who specializes in Crohn's and colitis. They obviously confirmed the disease. And I remember when I left the Mayo Clinic, based on where I lived, they actually recommended if things continue to deteriorate, that I actually go to the University of Minnesota Medical Center because it's closer. Well, lo and behold, 2 weeks later, that's where I was. This is the end of October 2018. So I haven't even been diagnosed for an entire year yet, and I'm truly struggling. That started my 30-day inpatient stay with the University of Minnesota Medical Center. I pretty much reached maximum medical therapy. There was really nothing more that could be done. 18 to 20 bowel movements a day, 7 colonoscopies in 1 year. It was decided in my best interest to pursue the surgical option. And so the first surgery was November of 2018, and I recovered extremely well from that first surgery. That's what gave me my ileostomy. I was given a little bit of time to determine if I wanted the internal pouching system or to keep my ileostomy permanent. And all it really took was the medical professional telling me the disease can still attack the J pouch. And I said, take it out. I want nothing to do with this disease at all anymore. My final surgery was February 2019. From that point forward, I focused on my recovery, getting healthy, letting my body heal, and then my motivation to try to work the process to get back into the airplane. I call my life in the last 4 years the rules of Novembers, because in November 2019, the team that I was working with, my military medical team, the civilian medical team, we did it. It is believed that I'm the first documented Air Force pilot allowed to return to flying status in the C-130, and that was in November of 2019. I've been flying the airplane ever since. I've never had one issue, and I've never regretted my decision for having the surgery one bit. I'm someone who lives with 0 medications, no restrictions, and no special diet. So that is kind of my story, short and sweet. And I live a life without fear having this ileostomy. I mean, I truly think it's a blessing. It gave me my second chance, and it gave me my life back.
Thank you, Josh. I think that's a fascinating story. And you shared a lot of great detail. I want to ask you, from all of this experience, what's like the lesson that you learned from your journey?
Throughout the entire journey, I think what's extremely important is if you start to recognize something that's really not normal with the way that you're living your life, whether it's bowel movements or you're just not feeling well. Kind of the same situation that I had as I started out at my local medical professional. And it seemed like it got to a point to where the situation I had or the symptoms that I had were just become a little too complicated for them to kind of handle. So it is okay to get second opinions. It is okay to go search for the subject matter experts, and you might have to do a little bit of work to find these people. But when I emailed the Mayo Clinic here in Minnesota, I got a phone call within 2 days. And so they're there and they're out there and they're willing to help you, obviously. And another thing to always remember is, like, if you get to the point to where I am, is people are here to support you as well. It's okay to speak to your immediate family. If you're still continuing to serve in the military, it's okay to talk to your leadership and your medical professionals about this. Because at the end of the day, as a military member, or even a veteran, or as a military member first, obviously we want to retain that asset. We've spent a lot of money to train you and get you to where you're going. It's a lot cheaper to retain than it is to retrain people. So the idea is there are waivers out there for certain medical conditions, but there needs to be a little bit of effort from the member to work hard at getting that back, whether that's with your health, the nutrition, and working through those problems and being open and honest about what you're dealing with. So those, I think, are 2 or 3 great things that I kind of stuck with. And just like I said, being open and honest about, what you're dealing with. It's okay to talk about inflammatory bowel disease. We know it's not a pleasant thing to talk about, but once you start to inform people, they might get an idea of what it is you're actually dealing with. Because I think I still remember it pretty much sucked the soul out of me when I was in those heavy flares. One example I tell people is I knew where every single bathroom was from my house to work. And I almost used those as checkpoints as I was on my 40-minute commute. There's that one bathroom, I made it to that one. Okay, here comes the next one. Or anytime you're out and about in a social environment, the first thing you think about is, where's the bathroom? Where's the nearest bathroom? That is not a good quality of life. Since I've had the surgeries and recovered, I don't even think about that anymore. So that's what's important to understand about inflammatory bowel disease is, for some people, it can really kind of suck the soul and the wind out of your sails, and you're depressed and you're down. You don't really know what is better. You're always trying to find, a medical treatment that's going to give you that glimmer of hope. Is this going to keep me in remission? So I think those are some good tips, is what I experienced in my time frame having the disease. And then, focusing afterwards, I don't really think about the past anymore. I just kind of think about the future and how I can be a better person and keep, doing the best that I can, because life is precious. We only really get this once. So please honestly take care of yourself.
That is fantastic advice, and really, and I know your story is very different and you are currently still serving, which is fantastic.
Correct.
And that's how your
Yep.
advocacy has really served you. I'm going to pose this next question to Dr. Prasad and say, his story reminds us of the value of having a good relationship with your doctor and your medical team. You're specifically within the VA. And I want you to talk to us a little bit about how this partnership could take place for someone who actually does get their care in the VA. How can IBD patients also be proactive partners in that healthcare setting?
Absolutely. That's a great question. So thank you so much for having me, and happy Veterans Day to all our veterans who are out there listening. The way I approach the patient-doctor relationship is, the first time you're meeting your doctor, it's always best to come in prepared. And so if you have a copy of all your medical records, including your colonoscopy report, your pathology result, your active duty GI clinic notes, any radiology imaging, if you can bring all of those to your first visit, it's going to make it that much easier for you to share where you've been with your doctor, and then also give them an idea of where you are now. And then finally, one of the most important pieces to me is, where do you want to go in your future? And so I don't only mean your medications and the blood work and clinic visits, but I also mean, who do you want to be as a person? What are your goals? What are you trying to achieve in your life? Because at least for me personally, so many of my veterans are students. They're starting their new lives, their new careers after leaving active duty. So many people are, if they're already veterans, they're moving to Atlanta, they're moving to a new city, a new state to start a new job. And so what does that look like? And what do you want your future life to look like? Because we certainly have to pick a treatment plan that's going to work for you. And so to me, that's one of the most important things, is sharing your story, past, present, and future. So that way your doctor can work with you and really make sure that we get the right plan to help you live that best life that you see for yourself.
And Dr. Prasad, I know you probably get a lot of patients that have been newly diagnosed. So what is the typical patient reaction upon receiving an IBD diagnosis? How do you keep your patients optimistic after receiving this news?
Right. So, the first thing, just as our lieutenant already shared, is that people start on the internet and do a quick Google search, and then they ask, well, why me? Why did this happen to me? And what do I do now? And so, I think there are many reasons that we understand and also don't understand about why people develop inflammatory bowel disease. But even more than that, I think the biggest take home for the patients is that it's not your fault. You didn't do anything to deserve this. You didn't do anything to create this situation for yourself. Many of these things are out of your control. And so to just take off that guilt of, what did I do to do this to myself? I think that's very important. And then that question of, where do we go now? And so this is where, to just listen to your doctor with an open mind, because some of the treatments do sound scary. There are a lot of, side effects and, potential adverse reaction, long-term effects. But then there's also a hope for a better life, and to really get your disease under control and live every day as if you don't have Crohn's or you don't have ulcerative colitis. And so to just keep an open mind to some of those treatments out there. And again, this is where, you share your goals, but then I, as the doctor, also share my goals for you and how that might look, and come to some sort of understanding of, that we have the same shared goals of getting you well and trying to negotiate and decide how we're going to get there, right? And so I think those are some of the biggest questions people have, and especially for veterans coming into care, at the VA. Some great ways to advocate for yourself and communicate with your doctor. We have the My Healthy Vet secure messaging. So once you're established with your doctor, it's the same as any secure messaging system, to be able to just communicate and let us know if there's a flare up or you didn't get your medicine on time. At least in our clinic, we have a nurse who checks that every day. And if something's emergent while I'm scoping, they'll just run over and grab me and get the answer to my question. Or if it's just something as simple as calling the pharmacy to release the drug right away. We have a lot of people to help us with these things, to help make sure that the course is smooth and you're getting the care that you need. So I think that's really important. And the other thing I want to add is that we have all the medications that are FDA approved for Crohn's and ulcerative colitis at our disposal at the VA. And most of the veterans are not paying more than a $15 copay. And so the medications are accessible. We have access to all of them. And so now it's just a matter of getting in and making sure we get you on the right one.
I like what you said about talking to your doctor about your goals. And for Josh, his goal was to continue his passion in his career. And now in retrospect, Josh, what are some of the things that you found most challenging then that have changed now? And another question to add to that is, what did you turn to, or where did you go to initially for support in that process?
Right. And so throughout the entire process, I think some of the challenges that I faced was, number one, is maybe even finding the proper healthcare professionals that truly understood what inflammatory bowel disease did. And that's ulcerative colitis or Crohn's. Sometimes based on the level of care and based on where you're at, you may not have access to that. So you might be dealing with someone who's more localized, maybe more broadly spread in medical care versus those who deal directly with inflammatory bowel disease, and that is their specialty. So the difficult part for that is you might have to travel or commute to get to that level of care that you possibly need, because at the end of the day, again, like Dr. Prasad mentioned, is get you on a treatment plan that keeps that disease in remission. Because I always remember during my 1 year, tenure of ulcerative colitis was I might be doing okay on basic mesalamine medication, which is generally that entry level medication. But I always wondered when is the next flare potentially coming? What would I be doing to potentially cause that flare to come? And I like what she said as well is, the why. When that diagnosis lands in your hat and you sit there and you go, did I do something wrong to do this? And I like how she responded to that question. So I went through the same thing. Was there something I could have done better or differently in my 37 year life that potentially this happened? But obviously they reassure you, like, we really don't know where it's come from, and that's okay too. So once I got to that level of care, was understanding again what the medication plan was. So starting out with the basic mesalamines, getting elevated to the biologics and getting put, prescribed Humira. How am I going to react to that, and what's that going to be like? When I was at the Mayo Clinic is when they threw the combination therapy with me. So that's Humira, Remicade, or any biologic with azathioprine. So, the scary part for me was I'm almost taking 9 to 10 pills a day just to try to keep my, my disease managed and hopefully get it back into remission. So before I had the surgery, was truly advocating for myself with my doctor to say, I'm not feeling good still. I'm still having multiple bowel movements a day. There were times I remember before I was hospitalized the final time of being curled up in a ball in my basement with, multiple bowel movements. And honestly, it felt like I had a bowling ball in my rear end because my rectum was so inflamed. And it was more or less just, getting the willpower to stand up and go, nope, I'm not taking this anymore. Somebody please drive me. And I would inpatient myself. I would triage myself. I would go to the emergency room and just say, I need to be seen because I am not okay. And that took a little bit of time for me to understand that. Post-surgery, the biggest things or challenges that I had to come over, initially was just learning how to adapt with my stoma and my ileostomy. I remember coming to after the first surgery, when you're slowly waking up, my surgery was about 4.5 hours. And I looked down and I'm like, I see this giant, pouching system on my abdomen that the hospital graciously provided me. It's massive. But then again, was starting to understand what my stoma looked like, how to care for that thing. Post-op, when you're done with surgery, you're trying to recover, get off the pain management and start to move your life in the right direction, was trying to absorb all that information that the WOC nurses were coming in and trying to teach. I remember the scariest point I think I had was, and this is truly a testament to how weak I finally became with the disease, was the physical therapist came in, I think on day 2 of post-op. And she's like, we're going to get you out of bed. So I do the old log tuck and roll. out of bed. And she's like, we're going to walk to that door. And the door was honestly maybe 15 steps away. I'm like, no problem. Let's do this. I didn't even make it 8. And so that was a massive eye opener for me. It's like how, truly how sick I had become, how malnourished I had become. And I thought at that point was like, never again am I going to allow myself to, get that weak or that ill, even though I know partly it wasn't my fault. But that was my motivation to keep moving forward was, the 8 steps I did one day turned into 12 the next day, which maybe turned into 16. I never gave up. I always kept small goals that I could accomplish every day. It's a marathon. It is not a sprint. It takes time to heal and recover because, those small goals turn into little victories, and that gets you the motivation to move forward each day. But pretty much the bottom line for, little things to overcome would just be how to live my life and adapt having the ileostomy. And I was pretty fortunate. I recovered extremely well. I adapted to my ileostomy extremely well. It took me a little bit of time to find the proper appliance system set up because they kind of give you the hodgepodge of everything of try this brand, try this brand, try that brand, see what works best for you. And that's kind of that troubleshooting period you're going to have initially coming out of surgery. But once I locked into a product and an appliance, boom, I just kept moving forward because I had this security, the sense of security with my appliance. I had found a nice accessory to wear with my appliance, and that was a stealth belt. They make wonderful belts. And once I had that, now it's cleared medically to actually start to increase the exercise. I started moving, 5 pounds one week turned into 10 pounds the next week. And then I just kind of kept moving forward because one of the things I wanted to prove to the military medical staff is that I was physically fit, even though I have an ileostomy, and I could do that. I could do sit-ups, I could do push-ups, I had the waist measurement, I could do the run. So that's what I focused on. And then some of the other things that I needed to focus on was kind of how to overcome some of the verbiage they had in the waiver guidance. I think one statement I remember was not compatible with military aviation, such as an ileostomy. And I thought, well, what does that mean? And so I'm a C-130 pilot. We have certain conditions. An example would be we cannot, they didn't want me operating in a blacked out environment. Well, I have a rules and regulation that states I cannot do that anyways. And oh, by the way, I got a bathroom in the back. So it's kind of overcoming some of that framework that they had laid out and kind of poking holes into that. But again, the civilian medical support team that I had was instrumental with that process as well. And actually, like I said before, people seeing my decline when I got sick and then seeing me getting better, they started to believe it. And they go, holy smokes, this could be a possibility because he's actually recovering extremely well. So those were just a couple. And I've had this for about 3 years now, and I just keep moving forward. I just think about the future. I don't think about why I got the disease, how I got the disease. I don't dwell on it. I dealt with it. It was an obstacle I needed to overcome in my life. And I just want to focus on the future.
That's very empowering. And Dr. Prasad, I'm sure you hear that transgression into empowerment, even with patients you see in the VA as well. But it takes time, as you hear from Josh's story. I want you to talk to us about that in terms of the mental health aspects. Why is it important for veterans with IBD to seek psychosocial support? And what are some of the challenges veterans may be facing where mental support could be beneficial?
That's a great question, Kat. So, many veterans, whether or not they have inflammatory bowel disease, have had so many experiences that civilians just can't even imagine. And so having lived through these experiences, post-traumatic stress disorder, depression, anxiety, many other psychiatric comorbidities can coexist in the setting of also having inflammatory bowel disease. And so if you have a veteran who has any of these conditions and inflammatory bowel disease and is dealing with a flare, is up all night and not able to sleep, suffering with the pain, you can only imagine that that is going to exacerbate some of these underlying conditions. Or even in a veteran who never had any of these psychiatric comorbidities, to have those feelings that go along with depression or anxiety. Those are really very real things that they're going through that can have a huge impact on the quality of life. And so at every VA, we have quite a robust mental health services psychologists, psychiatrists. Most of my veterans, I would say, are already plugged into mental health. At the top of the banner, you can see who the mental health treatment team is at the top, right next to the primary care. So it shows the importance that's placed on that. But then for our veterans who are not already plugged in, when they're triaged in the clinic, the nurse does a depression screen. And if anyone that they encounter in the medical center during the course of their visit is suspecting that there could be some depression, some anxiety, some mental health issue going on, we'll often just start with a conversation to address it and then help refer them to the proper services that they may benefit from. And so I think that sometimes it feels easy to suppress those feelings and not want to bring them up, especially when it's to your GI doctor and you already have so much to discuss. But I think that's an important part of the visit. And it's also, just along right up there with preventative health, IBD treatment. It all goes together and part of making somebody feel well. So I do think it's an important component. And certainly I've walked patients right down the hallway to our walk-in mental health clinic when they're especially having quite a bad day and they really need that urgent help. So it's wonderful that we have access to that.
I'm going to continue on that vein as we wrap up our program. I'm going to ask this question of both of you. Let's start with you, Dr. Prasad, since we might have some veterans with IBD listening today or that will have this program shared by their loved ones to them. What's one piece of advice about navigating the VA that you might offer for people who are probably going to be transitioning into the VA? Are there any words of encouragement to those currently living with IBD?
That is a great question. So I think one of the most frustrating part for veterans is getting their foot in the door, just figuring out how to navigate and how to just get established with the right treatment team. Because once you get in, then you have the secure messaging, you have the phone system, you can just walk right up to the clinic and you're an established person, you can get your questions answered. But the hard part is, how do you even get to that point? And so I think for anyone who's in active duty, to get all your records together and make sure as soon as you've left active duty and you've left your military doctors, to go ahead right away to your closest VA facility and check in with eligibility, go ahead and get your paperwork filled out and get the process started. And then if it seems that there could be any delay in getting your GI care addressed, I think all the medications are important, but some of them, might have been refilled for a whole year by the military doctor, and that buys you quite a bit more time than someone who's on an infusion, and it's more time sensitive. They really need to get that infusion done in the next 4 weeks, 6 weeks, 8 weeks period of time. And so I think that once you've established an eligibility and your name's in the computer, if you just walk up to the GI clinic, the GI lab, and just say, hey, I'm a new veteran who has inflammatory bowel disease and I'm on this medication, I really need to get in. Then as soon as a provider is notified, then we'll take it from there. And so I think the hardest part is just knowing. I can't tell you how many conversations I've had with people in the hallway and then kind of just take their records from them and say, let me give you a call back, give me your best number and review them and help get them plugged in. So I think that unless your provider knows about you, it's hard to advocate to help you get in. So that's number one. I think number two is for those people who are already in the VA system, who are traveling or moving from one city to the other, there's a traveling veteran consult that your doctor or provider can enter in for you to help with that transition to a new city. So, if I know that somebody is vacationing in Atlanta or moving to Atlanta, I'll receive a traveling veteran consult. Next time you go. And then I can help to just, as soon as we get that, I can just look at the remote data to check their records, just confirm what medication and regimen they're on, and go ahead and get those orders in right away and have my nurse help coordinate the infusions so that we don't have to lose time. We don't have to risk developing resistance to these medications and risk having a flare for someone who's in good control. So I think those are two big tips that I have for those listeners out there.
And it sounds like a good tool is the My Healthy Vet portal. So that's a good one to note for anyone listening. So thank you so much. All right, Josh. So you're actually living with this experience, and you have had such an amazing and fascinating, inspiring, all the wonderful adjectives in terms of how proactive you've been. What advice do you have for veterans and to those patients who are currently in service about living with IBD? What words of encouragement do you offer, having gone through your experience?
Yeah, great. So finally, for everyone, those who is listening, for the veterans out there, happy Veterans Day. You've all earned it. So hopefully you enjoyed that day. But please just be mindful that anyone who has inflammatory bowel disease deals with it completely differently. Yes, I talk about my story and the severity that I had, but you might have people who have inflammatory bowel disease and are in a deep remission with basic medication, and that's outstanding to hear as well. You might have some who are in deep remission on biologics, and that's excellent as well. Unfortunately, my body just did not respond to that, and I'm okay with that. So, I mean, hopefully we provided, both sides of the spectrum of some things that might be experienced with inflammatory bowel disease. So number one is everybody is different. Just because I talk about my story, someone could be completely successful in a different realm with inflammatory bowel disease. Number two, life is precious. Last time I checked, we really only get one shot at this. So be proactive and advocate for yourself, because at the end of the day, my bad day now is nowhere near the bad day I had when I had inflammatory bowel disease. So just, I'm pretty sure 10 out of 10 of us will die at some point. I want to actively participate in my own life and keep, I have a family, I have 2 young daughters. I want to be there for them, but I also wanted to set examples for them as well as, hey, remember when dad got sick and how he worked through that? Hopefully I can, teach that onto my girls. Don't ever give up. I mean, I'm pretty sure any veteran out there, anyone who's listening, we've always heard the motto of keep your head down, keep moving forward, one foot in front of the other. And no matter what, at the end of the day, do not quit. And there's always hope. Hopefully the story you heard from me provides a little bit of hope that there are other options out there as well. I believe, me personally, and this is just one guy's viewpoint, I'm much happier having my ileostomy versus being on a medication treatment that I was on. I mean, at some points I was taking 10 pills a day just to hopefully try to keep my inflammatory bowel disease in a state of remission, which I never really quite got to. And I don't get disappointed about that. Lastly, be open and honest about what you're dealing with until you actually start talking about it. Again, it's a nasty disease. It talks about one of the areas that no one really wants to talk about with the human body. I can't thank Dr. Prasad and her staff or anyone who works in the inflammatory bowel disease colorectal realm, because they see kind of the most intimate parts of our bodies. But I think most of these guys would tell you that, at least in the colorectal realm or inflammatory bowel disease realm is, hopefully we can watch the people recover and get moving with their life again. And I think that's rewarding for them as well. So you need to have those open, honest conversations with your healthcare providers, with your immediate family, with your leadership if you're still serving, and your medical support staff if you're still serving. Because at the end of the day, I think the most important piece with the military is its personnel. And we want to hang on to that experience as long as we can. But just know it sometimes, it may not work out in the end, and there's other avenues you can always pursue further down the road. So thank you very much to the Crohn's and Colitis Foundation, and happy Veterans Day to everyone who is out there listening.
Thank you. We all echo those sentiments, and I want to personally thank you on behalf of the foundation for your partnership and just the open nature in which you've shared your experiences and positive message out there. I think we all need to hear that on a day like today. So thank you so much. That's all the time we actually have for tonight's chat. And we hope that the chat provided some welcome, hope, and inspiration and feeling of support. For more information about IBD and veterans, you can visit our new webpage posted in the chat below, or www.crohnscolitisfoundation.org/veterans. Stay tuned for more helpful resources that will be added to the page in the coming weeks. So we're very excited to share more with you. Again, I wanted to thank our guests for tonight. We are so lucky to have your partnership. So thank you so much for joining us this evening. If you have questions that were inspired by tonight's chat that were not covered or answered, please do not hesitate to contact the IBD Help Center at info@crohnscolitisfoundation.org or by dialing 1-888-MY-GUT-PAIN. Have a great evening, everyone, and happy Veterans Day.